Hello, I'm Delia Dolor. Welcome to the program. St. Lucia's hospitals, wellness centres and polyclinics provide many services that you may not be aware of, and this video is here to inform you. From preventative care clinics, discoveries at the pathology lab, additional clinics available at many health providers, to the new specialist machines, which means some of our patients no longer have to leave our shores. Stay with me while we visit the Owen King European Union Hospital, the St. Jude, Dennery and Soufriere hospitals and the Gros Polyclinic. This programme also features interviews in Creole and I'll ask you questions along the way. Let's discover the services and improvements in St. Lucia's healthcare together. Coming up, we explain the transitioning from the Victoria Hospital to the Owen King European Union Hospital. CT scans and MRI machines are located at the OKEU Hospital. Dentistry with breathtaking views, especially for children. But first, St. Lucia has 2 general hospitals, 2 district hospitals and 33 wellness centres. Would you know which healthcare service to go to for your ailments? One of the main perceptions is that you should visit your nearest health centre. Yes, that's very convenient, but what if your nearest centre doesn't provide the service, test or treatment you need? You can call or go to any of St. Lucia's hospitals, wellness centres and polyclinics and ask. Here are some more perceptions that we'll discuss later in the programme. Long waiting times. If you ask, nurses and staff can explain how they operate their appointment systems and how they determine which patients needs to be seen first. CT scans and MRI services are only available at Tapion Hospital or Martinique. Not anymore. The Owen King European Union Hospital has a CT scanner and an MRI machine. St. Lucia's Health Service does not provide international standards. St. Lucia's healthcare professionals have been trained at home and abroad and keep in touch with medical issues. It's part of their job description, and they are the people who have a natural tendency to care. The Ministry of Health and Wellness has a mandate to provide best care practices.
Men are socialized not to pay too much attention to pain and to little illnesses, as they may put it. We're brought up to be strong. You fall down, you have to get up and don't worry about that, that's going to wear off. And as a result, you find that we wait till it happens for us to realize that it has happened. And so as most people see, sometimes it's too late. We are socialized by even our mothers, grandmothers, aunts, that a bellyache is get a bush tea. Mm-hmm. A cut is just put some medicine on it and it's going to go away. A sprain, a compound fracture, by the time we have it on, we want to move on. Men are the breadwinners, so the priorities are family, the majority of them.
Well, I have to say I understand and respect what you're saying, but I also think there's an element of fear.
Fear? There may be some fear, because I know a lot of persons are afraid of needles. A lot of persons are very sensitive as to who handles them, who touches them. So quite a few men could join between, do I go to a female doctor or a male doctor? Do I feel comfortable discussing certain things with a male doctor or female doctor? I mean, when you looked at long ago the whole process of testing for prostate, which is through the anus. Nobody wants, no man wants another man, or even a woman to go there, So there are certain things that really cause men to lay back, to stay away until maybe it is absolutely necessary to have to go there. And even when it still was a really torrid time, just getting it done. So I think that going forward, probably it might be best that persons that socializing our young boys, our male figures from childhood, to accept health education and to take it seriously. So look at the whole issue of having checkups and what issues that they'll be facing. So that, by the time they get into adulthood, it's almost a seamless transition of a habit of going to the doctor at least once a year. or twice a year, to do your own checkups to make sure that things are going right. Because right now, the progression of cancers and all these other illnesses, we fall along very quickly. Heart attacks, strokes. Right now, young people getting that. It's no longer something that's subscribed to the older folk, as we put it. So, it is really the socialization process that we've been exposed to as men.
But when you say socialization process, it's also about how we talk to each other and how we tell that man to go and see about his health. Would you agree?
It has a lot of that to do. I mean, my father or fathers in my time of my era would not have sat down with his sons and spoken to them about prostate cancer or these kind of things. That was something that, if it happened, you would deal with it. We're not even mothers sat down with their sons and spoke to them about healthcare. You have to go for screening and whatnot. They may have mentioned it, but mentioning is not the same as socializing an individual. If for instance your significant other was sick, you quicker take that person to the doctor, quicker take that child to the doctor and make sure they're healthy, because the priority of our healthcare was at the bottom of the line. Other things came into focus. So really, it is really a process now that we have to get into of teaching our children from early. There are health issues that could face us at any time, and it's important for us now to even start taking them to the doctor from the time they are children. The whole issue, you find that sometimes you plan this to the dentist, but you only do it when it's summertime.
Or when the tooth aches.
Yes, or the tooth has broken.
Yes.
But we really need to now take a more proactive approach in making sure that persons understand that healthcare is expensive, it's necessary, and it's something that if you don't take care of it, it's going to take care of you in the wrong way.
Yes, well, I agree with that.
And as a result, then now you're not able to do a lot of things that you should be able to do.
Well, but thank you so much for your time. The Millennium Heights Medical Complex is made up of 3 entities: the Owen King European Union Hospital, which replaces the Victoria Hospital, the National Mental Wellness Centre, and Turning Point Drug and Alcohol Rehabilitation Centre, and they all work together to improve the healthcare system. The OKEU Hospital brings many improvements to St. Lucia's health service. After transitioning, new services will be introduced via a phased approach. MRI and CT scans will be operational. There'll be more operating theatres, a larger accident and emergency department with more beds, more comfy doctors' quarters, staff cafeteria, a state-of-the-art kitchen, and much more. Medical Director Dr. Alicia Eugene explains her role and the new services.
As the Medical Director, I am the clinical lead, which means that I'm responsible for the supervision of all clinical matters, and that will put under me the all physicians and also lab, although the lab itself is, there's a head of department for the lab who is a physician who I supervise, and the same could be said for X-ray, and also the emergency medical technicians who are responsible for the ambulance services that we have at Victoria Hospital and the Owen King European Union Hospital. It will show progress and also show an improvement in St. Lucia's healthcare system if you look at what's existing now at Victoria Hospital and compared to services we have at the new hospital, realize that we have X-ray services that are improved. For example, we have MRI, we have CT scans, which we have a CT scan machine. And right now, persons who need a CT scan machine needs to go to Tapio. Whereas now at the Owen King, we have the machine at the facility itself. Most persons, when they want to do an MRI, they may opt to use Tapio somewhat or travel to Martinique overseas. Now we have this actually being in our hospital. We're also looking at our ICU capacity. At Victoria Hospital, we have 3 beds. And now at the new hospital, we're looking at 6 beds. Okay, operating theater at Victoria Hospital, we have 2 theaters where we do general surgery, general anesthesia, and we have another one where we do small day surgery, small short surgeries that you could complete within a day and persons can go home. You're now looking at that being done with 4 theaters being available at the Owen King. And we're looking at other services also that have been improved. Our dialysis services, our A&E, we have more beds at our new facility compared to the old facility. We're looking at the comfort, the whole comfort of the doctor's quarters being more comfortable. And we have CSSD, which is our central sterilization unit. We have a very large department where we sterilize instruments, gauze, and all the others, tools or material that we need for surgery, etc. So there is so much more that we are offering now, or will be offering in the new hospital compared to what is being offered at the present Victoria Hospital. Okay. Additionally, when you look at the what we have at Victoria Hospital compared to what we have now, you're looking at the fact that we have to be able to move across. You know, you have the situation where we have our bed space situation, but we've actually reached a point where we have to divide or really separate our patients to what is more acute and what is less acute. So then it has forced us to have a greater relationship with our sister departments like mental wellness, St. Jude's Hospital, and even engage Tapia Hospital in certain cases. And then, of course, the whole transitioning process, which you may have heard persons speaking about or our colleagues speak about, you may very well realize that it have caused us to have a stronger working relationship with other departments under the government of St. Lucia, like police, fire service. Okay, so this whole process have forced us to strengthen what exists, but also encourage further relationship with other departments that makes the healthcare sector a stronger, more robust sector. Okay, the complex is actually made up of 3 entities. You're looking at the Owen King European Union Hospital, which is actually supposed to house the present Victoria Hospital, the St. Lucia National Mental Wellness Center, and Turning Point. So these 3 entities will fall under the large umbrella of what you call the Millennium Heights Medical Complex.
And of course, that is a huge.
And that is very huge, because then we're putting up, we have the 3 different entities working together to improve the healthcare system, but really very close to each other. So then it forces us to actually work together to see what we can do to improve our healthcare services. And we've been doing this, and we will continue to do this to ensure that a patient coming in will get all the services that they need.
I have a question for you now, with the answer provided right afterwards, followed by the Creole segment with Fennell Neptune. Question. The OKEU hospital can conduct CT and MRI scans. True or false? Answer, true. Having a CT scanner and MRI machine at OKEU hospital is a huge improvement to our healthcare. CT and MRI machines were only available at Tapia Hospital.
Epi démarche la côté l'hôpital neuf la Owen King EU, ka we place l'hôpital Victoria, gouvernement ni espoir ki, la kay ni go pogwe à service sorti à cette lycée. Directeur médical à l'hôpital Victoria, Dr. Alicia Eugene, parlait des bénéfices mouvement sala by cette lycée.
Mouvement sala kay aider secteur sorti. Pour ce qui nous avons sorti à l'hôpital Victoria et nous avons entré à l'hôpital neuf qui n'est plus service et nous avons fait plus même service que nous avons offert. Par exemple, département radiology qui a fait X-ray, ultrasound à Victoria, même si nous avons fait même bail à l'hôpital neuf là, nous avons fait plus. Par exemple, nous avons fait MRI, nous avons fait CT scan. Et puis moi chaque monde savent là, on est pour faire CT scan, on est pour aller Tapion pour faire, et puis MRI délai on pour aller Martinique ou l'autre place pour faire. So c'est un bon bail nous ça fait ces tests ça cette ici même à l'hôpital ça. OK, nous avons chambre d'opération l'hôpital Victoria nous et puis nous des chambres et puis nous une chambre nous fait l'opération. À chaque temps mon ka venir, yo ni chaque monde pour faire l'opération, nous pour mettre yo dans manière pour mon délai mon ka venir janvier et puis on pour venir en février pour faire en plus tard l'année, mais à présent nous ka ni 4. So mon ka ni en chance pour faire l'opération, yo pas ni pour espérer chaque temps. Yo ni en chambre en département nous ka ICU. Si mon pas savent ICU, ka ouais c'est mon là qui très critique. Yo ka dormi à ce couche là, yo ni en rose en bouche yo à sur machine. Nous ni 3 couches quoi en Victoria. À l'hôpital neuf là nous 6. OK? So tout ça c'est manière nous ka wè, il ka imprimer l'hôpital ça passer l'hôpital Victoria because même si moun ka malade, mais yon ni plus chance pour sauver moun, sauver la vie moun because yon ni plus bail pour faire, yon ni plus place pour aller, plus chambre pour plus couche et puis plus couche pour atteindre ces moun là qui très critique.
Es epi l'hôpital neuf la Owen King EU. Cette liste kay we go progrès à ce service sorti qui kay available by mam public la. A oui, B non. Réponse là c'est oui.
Moving home is very stressful, so you can imagine how complicated and calculating it would be to move one hospital into another. Apart from the disruption to operations and services, hospitals need to take a thorough look at cleanliness and safety. They need to decide with great accuracy how are machines moved, how are patients transferred safely, how do you coordinate working with external agencies, how is staff orientation implemented and emergency procedures learned, as well as having a decommissioning plan to avoid contamination. I asked Sister Ruth Adisanya, what does it entail transitioning from the Victoria Hospital to the Owen King European Union Hospital?
Transitioning is a very involved process. This has been ongoing for a very, very long time. It involves a number of key stakeholders, both internal stakeholders being our staff, Ministry of Health, and a lot of external agencies, the EU, international agencies. From 2012, we have been working, when I say we, the staff at Victoria Hospital and the Ministry of Health by extension, have been working extremely hard in terms of implementing a number of activities for transitioning. In 2012, we had an EU consultant who came in to assist us in starting off the process. That was from between the years 2012-2013. From then until now, there are numerous plans that have been put in place. We had to consider everything that is required to safely transit into Owen King EU Hospital. When we say safely transit, we had to look at our patients. We had to look at all the requirements of our patients. Look at our staff. So that includes looking at our equipment. How do we transit into the facility and manage our equipment? We had to look at the preparation of the spaces. We had to look at the services themselves. In as much as the services at the Owen King EU Hospital are similar to that at Victoria Hospital with a number of improvements. Because of the difference in the layout of the Owen King EU Hospital, there were a number of our processes and workflow procedures that had to change. So we had to look at, from a management perspective, how exactly are we going to offer these services within the spaces that had been given to us. So there are a number of plans that have been written by the staff, where the management of each department is concerned. There are operational policies that had to be written and taught to staff. There's equipment move plans that had to take into consideration the new equipment that had been given to us, the equipment at Victoria Hospital that has sufficient life to be transferred, as well as any gaps. So any new equipment that would be required that would have to be purchased by us to ensure that we fulfill the requirements of this facility. In addition to that, we had to look at unit preparation. So we have a building, never been used. So how do we safely enter this building? How do we safely operationalize the department? From infection control procedures, which includes cleaning, to how do we stock up? What do we require in every single room? So the staff at Victoria Hospital have been very, very active for a number of years, putting all of these plans together. When it comes to the massive thing of moving a patient, it's not as simple as putting a patient in an ambulance and transferring them across. How do you do that? How do you move all of the patients at Victoria Hospital into a facility, in a short space of time, within one day? So there's an extensive patient move plan that gives details of all of this. That also includes working with our stakeholders, like the police and fire service. They are very involved in whatever we do. So they work with us in ensuring that these plans are where they're supposed to be. And with all of that, every staff member who works within Victoria Hospital must know these plans. So it's not just a matter of having management plans and activity and procedures. Every staff member had to be oriented. So we have a comprehensive orientation plan that had different levels. So phase 1 of that plan included just the physical layout. How do you get it? How do you find your way around? This is not a Victoria Hospital where when you walk through the gate and you go up the hill, everything is in front of you. It's a very complex building. So everybody needed to know not just how to find their way to their workspace. If there's an emergency, how do you handle it? How do you assist another department? How do you evacuate? So we had to look at our emergency procedures, and we had to orientate all our staff on that. These activities are still ongoing. Until we move into the facility totally, these activities will continue to be ongoing. And even after the move, there are plans that had to be developed to decommission the spaces at Victoria Hospital. When you move out of a hospital or even a house, you don't just leave the doors open and turn your back. And with a hospital, it is even more critical because there are inherent dangers in a hospital in terms of contaminants. So we had to put a plan in place to look at how do we deal with that. So our decommissioning plan, looking at our checklist so that every space that we vacate is left safely at the hospital. So like I said, a lot of work, the staff at Victoria Hospital are doing all of this along with the other duties. Persons were not assigned separately to do this. So they're continuing to work at Victoria Hospital, fulfilling everything and doing all of this. What I think the public needs to know is that the services that will be offered at the Owen King EO Hospital encompass all of the services that are offered at Victoria Hospital with improvements. I don't want anybody to think that, we're moving across and so the way things are at Victoria Hospital in terms of access to care or services being offered will be less. It will be more. We have sophisticated equipment here at Owen King EO Hospital that we don't have at Victoria Hospital. So we will be able to perform a lot of diagnostic tests here that we could not do at Victoria Hospital. Regarding our teams, what I'd like people to know is we work very hard. We have dedicated persons, team members who go above and beyond to make this happen. It is not an easy thing. Moving a hospital is it's a huge thing. And with all of this, them working extra, they are so enthusiastic and so motivated. So we are working hard. Our focus, our goal is to ensure that patients and staff move safely into Owen King EO Hospital.
Question. Transitioning from the Victoria Hospital to the Owen King European Union Hospital includes staff orientation, transfer of machines, learning new emergency procedures, and planning and providing more services and clinics. True or false? Answer: true. Planners have to factor all these elements into the transition and at the same time be extremely critical of the inherent dangers of contamination.
Abade masala kote ministère de santé ka fait mouvement sala hod l'hôpital Victoria pour l'hôpital neuf la Owen King EU. La aussi ni chai communication et puis c'est travailler l'hôpital là, officier ministère de santé et puis agence satellite et puis international l'Union européenne. Travailler l'hôpital Victoria et puis officier ministère de santé ka travaille bien wed pour mettre programme et système en place pour assurer mouvement ça là c'est yon qui s'en sauve pour ces patients là et puis travailler. Yo aussi ni pour garder bagay comme ménagement équipement médical, affaires de préparation ces places là à l'hôpital neuf là, service là yo kay offert même public là et puis plusieurs l'autre action. Directeur pour nurse à l'hôpital Victoria, Ruth Adisanya, parlait dit ça même public là supposé ça as affaires de mouvement l'hôpital Victoria pour l'hôpital neuf là.
Ça même public là supposé ça aussi à l'hôpital neuf là. Même ces qualités services là qu'on joindre à l'hôpital Victoria, ces services ça qu'il a la qu'il n'y plus service passer ça. So ma vle personne quoi là yo kay ped rien les nous quitter Victoria et aller à l'hôpital neuf là. À l'hôpital neuf là là n'a chay improvement parce que c'est équipement qui là ça en cause nous ka fait plus bagay plus tests parce que nous ka fait à l'hôpital Victoria. L'hôpital neuf là la hana un chay plan et un chay bagay nous a fait pour assurer les nous mener ces patients là avec staff ici à tout bagay kay aller bien.
Es ministère sorti, Kachin plusieurs meetings avec ses travailleurs à l'hôpital Victoria, officiers à ministère avec plusieurs les autres membres secteur sorti, pour assurer et faire bonne préparation pour le mouvement de l'hôpital Victoria pour l'hôpital Nefla Owen King Iyo. Et oui, B, non. Réponse là c'est oui.
On September 9, 2009, the St. Jude Hospital was devastated by a fire, so the hospital was evacuated to the George Odlum Sports Stadium. Most services previously available at the old site have resumed, and in many cases, the number of services and specialty clinics available at the stadium have increased. The chairman of the St. Jude board, Dr. Sylvester Francois, outlines the services provided at St. Jude Hospital.
I must say that St. Jude's Hospital is now located at the George Odlum Stadium since September 9th, 2009. And we have been able to maintain and in the interim increased the services that we provide. To list them, we provide the basic, or should I say core services in medicine, which include internal medicine, obstetrics and gynecology, general surgery, orthopedics, urology, nephrology, ophthalmology, pediatrics. We also have the other supportive services we also have anesthesia. We have laboratory services, both clinical laboratory, that is the regular tests that we do, hemoglobin, electrolytes, and we have a histopathology service where we give results of tissue biopsies. In addition, we provide physiotherapy, we have pharmacy, we provide x-ray services, we also provide dialysis. Dialysis is a service where patients with end-stage kidney disease come regularly for treatment with a kidney machine to purify the blood. In the general surgery group, that's our services basically. We also provide, these services can also be broken down into emergency services. That's what we have in our emergency room for accidents, medical, obstetric emergencies. And we also provide outpatient services, which are many of the specialty clinics, like of those that I've listed above. And also we have a walk-in clinic where patients can walk in off the street with any problem, and we do take care of them. I must say our walk-in clinics enjoy a certain popularity with the population in that they are confident in our doctors. They see it as a one-stop shop in that they can have their blood tests done, investigations done. The doctors have access to their old notes. And so we have a very busy walk-in clinic, which competes with what's done in the community. Yes, that's about it in a nutshell. Did I mention that we have operating room services? We have 24-hour operating room services for both emergency surgery and elective surgery. Provide surgery in the areas of general surgery, orthopedics, obstetrics and gynecology, ENT, urology, and maxillofacial surgery we also offer at our hospital. We have a new morgue at the old site. It is complete. It was donated to us by the people of Mexico, the Mexican embassy, and it is a morgue that is fully equipped, that is to perform post-mortem examinations at the highest international standards. We're hoping to commission it soon.
Question: how many hours are operating room services open at the St. Jude Hospital? Answer: 24 hours. Emergency surgery and elective surgery takes place around the clock at the St. Jude Hospital in Villeport. When we come back, we visit the Dennery and Soufriere hospitals. But first, here's the Creole segment with Vanel Neptune.
En septembre l'année 2009, l'hôpital St. Jude tenait godi fe qui croisait place la côté où te ka fait l'opération ek wad la pour mamay. Depuis sa fête, résident en sud pays ka jouen service santé od l'hôpital la un stadium sport George Odlam la. Chairman pour board l'hôpital St. Jude, Dr. Sylvester François, parlait du service là yo ka offert à l'hôpital St. Jude.
L'hôpital St. Jude, depuis nous vini en stadium là, c'est après du fait en 2009, nous avons offert même ces services là, nous avons offert longtemps en vie l'hôpital là. Nous avons offert service de médecine interne, c'est pour les gens qui ont pressure, diabetes. Nous avons offert service de obstétrique et gynécologie, c'est pour madame qui a timamay et puis qui a problème femme. Chirurgie générale, orthopedics, pour les gens qui ont bois cassé, jambes cassées. Urology, c'est pour ces messieurs qui ont problème avec prostate, avec PCO. Ophthalmology, c'est yeux. Pediatrics, des timamay, toutes malades timamay. Et puis, à part de ça, nous avons service d'anesthésie, c'est les gens qui mettent les gens dormir, take care of les gens qui ont mal, et bien les gens pour un ventilateur. Et puis aussi, nous avons offert un autre service qui a un support pour ces différents services médicaux là, comme laboratoire, c'est blood test, nous avons fait physiothérapie pour les gens après une stroke, après une jambe cassée pour vous mettre sous pied. Nous avons fait pharmacie, car nous fait toutes ces drogues là, nous avons une bonne pharmacie qui a toutes ces remèdes là. Nous avons fait X-ray, X-ray c'est X-rays qu'on nous connaît, et aussi nous avons fait ultrasound. Et puis nous avons fait service dialysis. Dialysis c'est pour les gens qui ont des problèmes avec kidney, pour nettoyer kidney. Nous avons un chai outpatient service pour les gens qui par l'hôpital. Nous avons fait une clinique qui s'appelle Women's Health, c'est pour madame, pour faire pap smear, pour garder breast, si on a loupé avec cancer breast. Nous avons fait colposcopie pour garder un didant, cervix là, c'est un part womb là qui délégue ni cancer pour garder, pour make sure pour signer pièce défaut pour traiter les bonnets. Nous avons une clinique de diététician, nous avons un diététician qui est moun, especially les gens qui ont diabetes, pressure, conseil à ce qui manière pour manger. Nous avons une clinique pour diabetic foot. Nous savons les gens qui ont diabetes, ni pour couper les jambes, c'est pour éviter pour couper les jambes, so, pour traiter tout problème avec pied avec les gens qui ont diabetes. Nous avons aussi service de operating room, nous avons fait l'opération en différents, c'est pas en tout area, mais nous avons fait general surgery, nous avons fait orthopedics, les gens qui ont jambes cassées pour manger, obstetrics gynecology, les timamay pour faire pour cesarean section, ENT, nous avons urology, et puis aussi nous avons maxillofacial pour les gens qui ont des problèmes avec dents, avec Fiji. So, St. Jude's, un stadium là, qu'on fait, il n'y a pas de ça, nous avons fait service emergency, nous avons une emergency room pour toutes sortes de malades qui ont besoin pour accueillir immédiatement, accident, moun qui tombé, n'importe sorte de malade, emergency room là ouvert 24/7. St. Jude's Hospital, la gouvernement Mexico donné un morgue à Pep Saint-Lucie, à St. Jude's, et puis c'est un morgue qui j'ai fini, j'ai bien fait, il tenait tout outils, tout conditions pour faire post-mortem, pour faire tous ces tests là qui sont nécessaires. Les gens morts peut-être un accident, et bien, peut-être à l'hôpital, et puis c'est une place qui bien faite. Nous avons fait test, nous avons tiré portrait, nous avons une place pour police, pour famille, ça attend, nous avons storage pour mettre ces corps.
Résident au sud pays, ça joint même service là yo te ka joindre en l'hôpital St. Jude avant Godifer yo te ni en l'année 2009. Et oui, non. Réponse là c'est oui.
The Soufriere Hospital has recently been refurbished, which provided opportunities to review and add to its services. There is no harm in you knowing what services are available at the Soufriere Hospital so you can inform your families, and you never know, you may need to receive care here too. Principal Nursing Officer at the Soufriere Hospital, Nurse Alexander, outlines the services available and the hospital's future plans.
The services that are basically being offered currently at the Soufriere Hospital would fall under, be prioritized under two headings. Firstly, we offer primary healthcare services, or we normally refer to as our PHC department or unit, where we basically offer maternal and child healthcare services, early cancer screening services, medical clinics, mental health care clinics. In addition to this, we offer specialty clinics that are being offered to the general public on specific days of the month. In support or to strengthen our PHC unit, we also offer dental services as well as pharmacy services. The other set of services that we provide or offer to the public would include our urgent care unit or department, of which services are offered to the public on a 24-hour basis. In terms of our PHC department, most of our clinics that we offer to our general public are served on an appointment system. However, we are quite aware of the uncertainties, the limitations, the gaps that our patients may experience, and we also serve them on a walk-in basis. In terms of our urgent care department, our services or the services that we provide here at the Soufriere Hospital are offered to the public on a 24-hour basis. The availability of a medical team, which basically includes our doctors and nurses, are present here on a 24-hour basis where urgent care services can be provided.
Question: what times are urgent care services provided by doctors and medical staff at the Soufriere Hospital? Is it A, 5 a.m. to midnight, B, 7 a.m. to 7 p.m., C, 24 hours? Answer C, 24 hours. Soufriere Hospital provides a 24-hour service for urgent care. Yes, there is always medical staff at the hospital.
Pane l'autant, ministère de santé te wibati l'hôpital Soufriere. Wibâtissement l'hôpital là aussi pochuwe gouvernement et puis opportunité pour visiter et pour mettre plus à ce service là yo ka offre man public là. Yon docteur qui travaille à l'hôpital Soufriere, Dr. Mervyn Mack, parlait des services là yo ka offre.
L'hôpital a un service emergency qui a fonctionné durant la journée. Vous savez, pour 24 heures de temps durant la journée, avec n'importe qui a une pièce accident, pièce malade, CB, tout ça, vous savez, l'hôpital et qui a trois services, qui a trois attendre, l'année nurse qui a tout l'air, avec docteur aussi, avec moun sa ka un service. Bon, vous savez, service là nous ka provide ici, il pas nous pas tout bagay au monde qui besoin, par exemple, nous pas lab, nous pas X-ray qui ka function as such, so nous pas admit moun l'hôpital là. So on cherche les moun qui plus malade, nous quand pour voir dans l'autre hôpital, par exemple, l'hôpital St. Jude, l'hôpital Victoria, parce que là quand l'autre service nous pas provide ici à yoka ça l'autre bois. Aussi bien nous ça c'est service, moi just parle about service emergency qui fonctionne durant toute journée à 24 hours a day. Ça fait 4 heures de temps. Mais nous aussi ces cliniques là, nous avons créé ça primary health care primary health care, c'est moun qui, vous savez, n'importe quelle chose ou n'est, question maladie ou n'est depuis longtemps, vous savez, vous pouvez venir à la clinique là. Par exemple, moun qui a diabetes, hypertension, asthma, n'importe condition pour longtemps, that on peut manager là, vous pouvez venir à primary health care pour avoir une attention médicale durant la journée. Ça c'est from 8 h au matin jusqu'à about 4 h les cas fermés. Aussi bien l'année service dentiste ou ça pour occuper dents, l'année service zier. Bon, c'est pas toutes ces cliniques ça, c'est specialty clinique qui fonctionne tous les jours. Par exemple, qui fonctionne certains jours en semaine ou en mois. L'année clinique gynecologie aussi bien l'année clinique presque tous les jours qui fonctionne maternal child health care nous garder ça clinique ça qui prend que moun madame qui go boudin qui est enceinte ou qui just accouché avec maman. So maternal child health care maman, vous savez, c'est maman pour vacciner et development pour make sure you can profiter manière supposé clinique ça qui atteindre ce monde ça.
Résidents en Soufriere ça joint service santé hors l'hôpital là tous les jours. L'hôpital là pas qu'à faire les pièces. Est-ce ou ça dit nous qui est l'hôpital Soufriere qu'a fermé? Et yo pas qu'à fermer pièces, B menuit. Réponse là c'est yo toujours ouvert et pas qu'à fermer.
Did you know that the Dennery Hospital has one of the quickest response times by the St. Lucia Ambulance Service and that their services are available to everyone? Whether you live in Castries, Rizal or Monrepos, care will be provided to you. Let's find out about the services provided at the Dennery Hospital.
The services provided at Dennery Hospital include maternal and newborn care, which is our antenatal and postnatal care of. We also have child wellness services, immunizations, children, adults. We also offer diagnosis and management of both non-communicable and communicable diseases. Also diagnosis and treatment as well of the non-communicable diseases, which would include your hypertension, diabetes, asthma, obesity. We also have women's health services. Family planning is one of the services that we provide at the Dennery Hospital. Men's health. We do prostate exams. We also do breast examinations for our men. Medical clinics, adolescent health. We also do mental health services, obstetrics and gynecology, dermatology, which is our skin clinics, dental services. We offer pharmacy services as well as health information, health promotion and counseling, and also outreach outposts where we go out to the people in the community. Nutrition, medical coverage of community events, and also referrals to different institutions, different health institutions. Dennery has achieved increased and improved health services over the years. Before, there were a lot of services that were lacking at the Dennery Hospital, but today we can boast of these services now being offered. For example, our dental services, mental health services, also even the medical outreach, okay, covering all events. So these are things that have now been increased, and it has helped boost the services and the confidence of the people of Dennery. Dennery Hospital is underutilized. Again, I think it's because most people are not aware of the services. There's no signage at the hospital, and so people do not know that these services are provided unless they have been to the hospital. And we need to bring this out, educate the people of St. Lucia that Dennery Hospital offers all the services, or if not all, but most of the services provided at the Victoria Hospital, the Polyclinic at Gros, and Vieux-Fort as well, Dennery Hospital. Also, we can boast of a medical facility that provides care to the public with a quick response time. And also that it is accessible, and even the inviting environment, okay, from the security right down to the domestic assistance will provide you with an inviting environment. So we can boast of that at Dennery Hospital. Once you come to Dennery Hospital, you will return.
Question. Dental, mental and medical outreach has been expanded at the Dennery Hospital. True or false? Answer, true. Dental care is one of the most popular services provided at the Dennery Hospital. The outreach services are also popular and part of the improved services the hospital provides.
An set lesi, nou ni l'hôpital Dennery, kote yo ka offer plizye servis sante, même ko l'hôpital St. Jude, Victoria ek Polyclinic Gozile. Yon a de se gros achievement l'hôpital Dennery, se kote yon l'année qui passe, yo jamais te pli a sou servis sante a place la, ek aussi fay pli mehe pou man public la. Sa se servis ko zafè santé sevel, zafè dentiste, epi démarche la, kote yo ka participe a de aktivite commune la pou potiwe servis medikal. Met officier nurse a ministère de santé, Alicia Baptiste, di ki servis la yo ka offer avelab bay tout set lesye, epi yo aussi ka bay assistance medikal bien vitement. Set lesye sa jwen servis hod l'hôpital la, tous les jours commence à 7h bon matin pour minuit. Est-ce ça dit nous qui service l'hôpital Dennery ka offre membre public là? Et ça fait dentiste, B, ça fait de participer à des activités communes là pour poursuivre service médical, C, ça fait santé sévère. Réponse là c'est yo tous ces services yo ka offre à l'hôpital Dennery.
The Gros Polyclinic continues to provide quality health care to its community. Gros also has a health centre which is in the grounds of the polyclinic, and together they ensure that a number of clinics and tests are available. Sharon Alexander Joseph tells us about their services.
The Gros Polyclinic provide medical care for persons who need medical attention. We have the medical clinic where we have the doctors on shift from 8 a.m. to 12 midnight. We also provide radiographic unit, that is the x-ray, where patients could get the x-ray done. We also have the lab services where we do 3 on-site testing. We have the rapid HIV testing, we have the Gravidex, which is a pregnancy test, and we have urine testing. All other tests, we collect the samples and send them to the Ezra Long Lab at VA to do testing. We provide pharmacy where patients can have their prescription filled out. We also have the community health services where we provide hypertensive, diabetic, child health care, antenatal, dental services, and Friday weekly and Saturday medical clinics. These are some of the services that we provide at the Gros Polyclinic. We can look forward to the lab services. We want to upgrade our lab services. Currently, the samples are sent to Victoria Hospital for testing. So we want to provide on-site testing so patients can receive their results within the time that they're here. The other service that we can look forward to is extension of our operating hours. Generally, patients are satisfied with the service because they do return on a number of occasions. We have the wait time. We have had patients mention about the wait time. They believe that when they come that they are seen, the nurses explain to them that patients are seen on the severity or the urgency of the situation. So if we have persons have certain conditions, they will be seen first, and the others that are stable, they will wait until their turn to see the doctor. persons have voiced their opinion, we have a space limitation at JPC, especially in the reception area. So we want to encourage patients to work with the ID, so that will alleviate them having to voice out personal information. So working with the ID, this is very important. Generally, that's what we know from what we hear from the public.
Question. Doctors are available at the Gros Polyclinic from 8 a.m. to 12 midnight. True or false? Answer. True. Doctors are available at the Gros Polyclinic from 8 a.m. to midnight daily. Question. At the Gros Polyclinic, many X-ray and lab services are available, and there is also free on-site testing for many conditions. There is also a pharmacy. True or false? Answer. True. Tests taken at the Gros Polyclinic are sent to the Ezra Long Lab for testing. Results can also be labelled as urgent, providing quicker turnaround.
Polyclinic Gozile ka continue pochiwe qualité service sete by wezida a commune la. Aso Grands Polyclinic la aussi ni a place sati Sasi Wellness Center. Epise de facilité sala sam, de masala kai aussi fay yo pochiwe plus service clinic by Mampibik la. Yon nurse ki katwa via Polyclinic la, Tanzania Daniel, parle di service la yo ka offer.
Actuellement, à the Gros Polyclinic là, nous offrons différents faveurs services. Nous avons docteur pour la peau, dermatologiste. Ça c'est pour une maladie de la peau, vous savez, dermatologiste c'est un spécialité docteur. Nous avons fait X-ray, radiographie, c'est pour une mal pied et sous tomber et que pied et boire, ça on peut casser, vous avez fait X-ray pour voir si zo a cassé. Nous avons fait clinique by c'est mon qui go boudin, c'est antenatal clinic community, c'est pour si on go boudin et bien si vous savez docteur et bien c'est nurse derrière là, you can examiner pour make sure that ti maman la ka profiter bien, tout ba ka aller bien ou pas ni pièce problème. Nous ni pharmacie côté où ça acheter oui med. Pharmacie est ouvert from 8 h du matin pour 12 minutes. So ça gagne med one time là au docteur ça gagne med la one time so ça commence med la même. Nous ni lab côté nous ka fait basic test by ces patient là les vini. Nous ka fait test pour garder pour sick, nous ka fait test là pour garder si yo go boudin. Nous test nous avons sang from ces patients là même et nous avons envoyé de go l'hôpital là ça c'est VH. Nous ni docteur qui venu les lundi et les vendredi c'est docteur pour ces moun qui ni diabetes et c'est pressure yo ça là à son vendredi clinique là c'est ou pas pour payer pour clinique là sur vendredi especially so from community Gros ou ça just venir là et que ça ouais docteur pas pour payer et nous ni dete pour tirer dents nous ka tirer dents ba c'est gros moun là et c'est ti maman là nous ka aider pour nettoyer ses dents.
Wezida Gozile sa joint service sati hot Polyclinic Gozile ya, li ledi pour vendredi à 8 h bon matin pour men 8. Mais place sati à Polyclinic là, ka ouvert à soit samedi à 9 h bon matin pour midi. Gouvernement ka aussi gardé pour ouvert Polyclinic Gozile ya à son holiday et weekend. Magwe Polyclinic Gozile ya, pa ka ouvert à son holiday et weekend. Es wezida commune la, sa joint service sati, od place sati à son grounds Polyclinic la à son samedi. Et oui, B non. Réponse là c'est oui. Place sati à son grounds Polyclinic Gozile, ka ouvert à son samedi.
If you need to visit any of St. Lucia's hospitals or healthcare providers, don't forget to have your ID with you, especially if you haven't registered for One Patient, One Record, which allows you to be monitored anywhere you go within the National Health Service. More about this in another video. In the meantime, don't forget that extended hours are available at many health centres, so it's wise to find out about opening times instead of assuming the clinic closes at lunchtime. See you next time when we explore our health service. Goodbye.